Hello, I'm Smriti. I'm a special educator and a counseling psychologist. I'm making this video for giving more information about my upcoming webinar about behavior modification. So, this is mainly for parents of ASD children. So, when we are getting the diagnosis of autism, from there we know that our children have great difficulty in communication. Autism is mainly affecting their communication skills, but each child is communicating. So but the it may not be in appropriate ways. Most of the time they are communicating in inappropriate ways, like by screaming or by shouting or by crying or by throwing things or by pulling other people's hand or by biting themselves or hitting others. So there are different type of behaviors that may present in our children because they doesn't know the proper mode of communication. So this inappropriate ways of communication are called behaviors. So behaviors are not something special, that are inappropriate way of communication. Now, how to handle this situation? How we can train our children to communicate properly, to behave appropriately, so that our children will be acceptable in most of the places. When we all are thinking about inclusion, if the child has lots of these sort of behaviors, we know that it is very difficult for other people to accept our children. So it is a very important area that we have to work it out. So how we are going to modify these behaviors in an appropriate way? There are so many things, like our children do stimming with the thread, or so some sort of stimming behaviors will be there. But when we have to worry about the stimming behavior, always we are accepting our children, we all are telling we are accepting our children the way how they are. If we are accepting our children, we are ready to accept their stims also. But when it is going into a level that because of that the child is not able to function academically, the child is not able to do their daily life skills, then you have to worry about that stim. If the child is biting and biting himself or biting others, or the child is playing with saliva, then all the parents will worry about that behaviors. Then what we will do? First, we will try to understand the function of that behavior, why the child is doing that particular behavior. So, there is a procedure to understand the function. From that, we will understand it is a task avoidance behavior, or it is an attention seeking behavior, or it is a sensory seeking behavior. Like that, first we will try to understand, and then we will plan. So if it is a sensory seeking behavior, how to address the sensory needs in an appropriate way, so that we can reduce the number of inappropriate behaviors, and then slowly the child will start communicating appropriately and this behavior will go. If it is an attention seeking behavior, most of the time then parents will think just ignore, it is an attention seeking behavior. No, it's not nice to simply ignore. You have to understand why the child is trying to escape, why there is a problem with our program. Is it is too much for the child, or is it is too simple for the child, or the materials are according to the child's understanding. So there may be various reasons like this. And is the child is able to communicate properly in this situation? We have to work out all these things. So most of the time parents will think just ignore. It's not just ignore. We have to look back and we have to do the proper strategies. Then only the behavior modification will work. And no need of any particular session to teach the child to behave properly. Behavior is just communication, and that is happening throughout the day. A parent should be aware about how to handle these behaviors. Then your quality of life will be much better and you can move forward with that. And one more thing, when the children are, especially when the children are coming to 14 plus or 12 plus, when they are showing aggressive behavior or mood swings, it will start affect the parents a peace of mind. They will start worrying about it, and then they will go to depression by thinking that they were not taking care of the child properly, they were not giving enough time for the child properly, and that will create depression in the parent. There are many cases like that it is happening, because as a parent we all will worry when our children are going through that type of behaviors. As a parent I can also understand. So how to handle our emotions, how we can cope up with situation. So if you can understand the function of the behavior and if you can plan accordingly, that itself will be a great help for you. So how to keep your peace of mind, that is very very important in this journey. Yes, it is a lifelong journey, and we have to take it each step at a time, and we have to move forward happily, and both the child and the mother should enjoy the process. It's not like we are not going to cure autism. We are handling that, and we are helping our children to reach out their maximum potential by building life skills and by teaching them various skills according to their strengths. So I am planning this 2 hour webinar for helping parents to understand this, so that they can focus on to their child's strength, and their children will be included in the society when the child is showing very less inappropriate behaviors. I'm not telling I can give you the tips to stop all the behaviors within one day. It's not possible. It is a systematic work, but of course I can help you to give the most important tips that you can understand and how to move forward. So if you are interested, you can register by WhatsApp me in 9343726270.